with Dr. Brown, our researcher on the panel. So I'll just pose a question to you, especially knowing the work that you have been involved in. So in the rush to digitize learning and promote STEM education, we sometimes overlook the mental toll it can have on children, especially in under-resourced communities. From your experience, what are the hidden risks of this digital shift on children's mental health, and how can we design STEM programs that balance innovation and emotional safety? Over to you.
Thank you. Okay. Okay.
Thank you so much for that question. I would say this, that STEM is important, no doubt about that. For the present and the future, STEM is very important. And that the rush to digitize learning is on, no doubt. You have heard of the pronouncements recently from the education sector leadership that we'll be looking at 60% of the learners in the senior school to be joining STEM. And so that's already an indication of the rush. Then, so we also have proposals to have maths being elective. And so my role as a researcher is to research these kind of pronouncements and then share evidence that could influence policy, because in my space, we actually do research that influences policy. So another important issue is that we have under-resourced communities, for sure. We have the informal settlements, we have the rural people, we have the pastoralists, and we have many marginalized people, including the ones living with disabilities. So what are these hidden risks? First of all, for the education sector, the sub-county secondary schools are marginalized, in my view, in terms of access to resources, learning resources, including the STEM resources. There are many schools, for example, a school in my village called Lumama in Kakamega cannot match what we call national schools, and that's already a wellness issue in my view. Now, we lose our youth in the process. Some of the hidden consequences or risks, we lose our youth. They get social pressure. For example, imagine a youth without a phone in the current age, an 18-year-old to 20, 30 years without a phone. There's pressure on this child to access a phone, and so there's a risk. We have socialization issues, and it's been mentioned here about how you will get our youth together, but they're communicating on WhatsApp, for example, on Facebook, yet they are sitting together. So those are risks. We have longer screen time is a major issue. It affects the motor and cognitive development. It affects brings to social and psychological well-being issues, emotional problems, among others. There are many risks. We have equality is a major issue. For example, why is our education not the same? If we had schools equalized in the sense that they can provide the same quality across the board, I think we would be at a better place than where we are currently. And so, for me, there are many ways that we need to deal with this. Maybe provide safety guidelines on how to use the digital devices, emphasize physical movement, and I'm happy that Collins and team are using physical activity like sports. That's very important. There's a kind of regulation or rule, or whatever you want to call it, 20-20-20. 20 means every 20 minutes, do not look at the screen, look at something 20 feet away, and for 20 seconds. That's important just when you are sitting around. And by the way, as Jean talked today, in my organization, I don't receive email on the weekend. So from Thursday, before Easter, the next email came to me on Tuesday. And that's it. So I don't have a work email on my phone even. Today, I've not come with my laptop because I'm working here. So those are some of the things that we can do in our own small ways that will help. So there's a lot I could say. I don't know how much time I have, but for me, a call to action, apart from the coalition, is that I have to tailor my research in such a way that digital wellness is a factor. And so I'll be looking out to maybe collaborations and partnerships so that as we work in this digital space, there's a space for doing research that will inform the wellness of our youth. As I said, we lose them. I'll stop there and then get back to the
Okay. Thank you, Brown. I like the point on resourcing the under-resourced, especially in the marginalized communities. And maybe we can even, your 2020 rule, we can even implement it over here. So thanks for that. So then we'll now move to Dr. Jean. Especially now in your role at KHF, Kenya Healthcare Federation. How can KHF drive national policies to ensure digital wellness is prioritized in schools and workplaces? And yours will be in two parts. The next question will be, what role can PPPs, that's public-private partnerships, play in scaling mental health programs within Kenya's digital ecosystem? Over to you.
Thanks.
It's honor. Yes. Thanks, Val, for that question. Perhaps for those who may not be as familiar with Kenya Healthcare Federation, I can just give a very brief introduction of who we are. So Kenya Healthcare Federation is the health sector board of the Kenya Private Sector Alliance. It was set up about 21 years ago, really with the purpose of promoting strategic public-private collaborations, public-private partnerships to ensure that as a nation we're able to achieve access to quality care. Right, and so we do that by being really dedicated to engaging the government, other key stakeholders, so that we ensure that we're collaborating for the betterment of the nation. And so when we talk about national policies, we're set up in 6 different committees. So we have a membership of over 300, and not just in the healthcare space, because we know that healthcare is cross-cutting, right? So it's not just hospitals and medical associations, we have banks, we have academia, we have health insurance. And so the WHO, World Health Organizations, have 6 building blocks that are the core components of our healthcare system. And those are the 6 core committees that we have. So I sit on the Digital Health Committee. We also have healthcare financing, we have human resources for health, we have quality, we have supply chain, and we also have the public-private partnership. So you can see there's a wide range of expertise there. So when policies are being drafted, when we have bills that are coming, we ensure that we are contributing to the development, to the implementation of this. You know, we don't have a shortage of policies in Kenya, the regulations, the standards. So we're ensuring for any digital technologies that are coming out, where we are going to include these areas of wellness. You know, we go up to Senate level, to presidential roundtables to have these discussions. So we make sure that the private sector voice and the expertise is infused into what's happening. We put out position papers, right? So you can imagine over 300 members who are in the private sector space across all those different organizations. There's a lot of wealth of knowledge to be gleaned from that. So putting out positional papers on cybersecurity, on data privacy and governance, white papers on telemedicine, you know, on AI. How can we ensure that we're using these technologies correctly, right? And I already see areas of collaboration with you when you talk about AI, because so much AI is coming up in the healthcare space now. How do we ensure that we're innovating responsibly, that we're not marginalizing the underserved communities who we're seeking to increase the reach of access to? We do research with academic institutions, so like Strathmore Business School. There was a report that was done, and we were looking at the organizational level dimensions that really impact women in healthcare leadership. What sort of barriers in the workplace exist? What can we do in our workplaces to ensure? And we take that and we recommend. So similarly for schools, for workplaces, we put out these position papers, these white papers. We ensure that we are engaging stakeholders across the board. And then also because we have so many members within KHF, making sure that we're able to amplify the voice, amplify the work. Because sometimes the challenge is work is being done, but it's not always put out there. The person who is in rural Kenya might not know about it. So we're very deliberate about amplifying the work of our members. I'm glad that Penda Health will be here in the afternoon. They're very big in the wellness space, wellness in the workplace, in schools, and they have a telemedicine application. It's called Pigia Penda, where you're able to call and speak to a clinical psychologist. So Sharon, who's their clinical psychologist, will be here in the afternoon talking about the wellness programs. They're involved in the debates that we do, where we are going to Senate, to national government, having these debates to ensure that wellness is embedded into the programs. And one of our other members, HealthX Africa, they're showing how we can scale, through PPPs, mental health access. So they have their clinical psychologists, their doctors sitting here in Nairobi, and they'll partner with schools, they'll partner with county governance, and they'll partner with organizations. So they partner like with a tea farm somewhere in rural Kenya, so that they can get access to, mental health care. How do you do that in a financially sustainable way? So we're able to amplify all this work that's being done, share it. I quite like HealthX do daily tips. So this morning my daily tip that I subscribed to says, put away your phone. It was so timely. Make sure you put it down and look at it. I was like, do they know where I'm going? Are they tracking me? But it's on my kabambe, so I know they're not tracking me. It's someone like Kamuizi, So put down your phone and have a conversation with someone face to face. So these are some of the things that we're doing, sharing our learnings. Penda will share how they're able to offer low-cost, high-quality solutions so that you're able to scale public health and mental health solutions across the country.
Thanks for that, Jane. And for your daily tip, put your phone away. It's linked to what Dr. Brown was also saying, 20 feet, So I like that relation. And also thanks for giving the overview about KHF, and we are looking forward to hear what Penta Health even have to say, and even HealthX. So thanks for that overview. And now we'll move on to the media professional, Bonface. So now, as the media professional on this panel, and you've been engaging the youth, especially in your work at KUTV, what are some of the emerging mental health struggles you have observed that are being fueled by digital learning pressure, online comparisons, and social media trends? And in your view, how can campus media like KUTV play a stronger role in reshaping narratives around digital wellness and emotional resilience among students?
Thank you so much, Valentine. So immediately, in a really group of experts here, and it's a big pleasure. Number one, I'm in awe of Dr. Brown's ability not to be on his phone Thursday to Friday. Because on my end, I'm on my phone every other time. I'm here, but already still at work, because I'll have to respond to emails, finalizing on certain scripts that I have, doing the same for the students that I'm working with. So some of the emerging issues that I've come across is definitely burnout. Because from 6 a.m. I'm already up. I have to check on my phone and email, confirming with guests, preparing for a particular show. 7 a.m. already doing a live show as it is. After that, from 10 to around 1, I'm again on my screen, checking on production work that we recorded and need to be edited, reviewing of shows. So I'm quite on my phone a lot. Afternoon, we have a game changer show called Elimu Live, which we started during the COVID period. This was a time when learners were not able to access their teachers or even go to school. So Kenyatta University, being an institution offering education courses, it was only right for us to offer digital learning through this platform. And I'm glad Learnademy is here, because again, the whole point of us coming together was to see areas of collaboration to ensure digital wellness to learners or people who are coming on board. So mine again was on the burnout, because I realized I'm on the screen a lot, either for the TV or even on computers doing work. And this is relevant to about 50% of people who are around me. And you realize with computers and technology, slow internet, sometimes power shortages, things which can take your work back and always leads to a lot of burnout. On comparison, I do a lot of educational content, and it's not usually consumed to the highest level. Holding a public lecture with President Yoweri Museveni or even our current Chancellor, Dr. Mutaura, you realize I'm only getting up to 100,000 likes or viewers for that particular educational content. But on other main medias, they have 500 plus because they are showing entertainment or light content. So for a long time, this comparison issue was something that was killing me because we deal with metrics when we are doing this production. So when I look at what my other competitors are doing and what I am getting, I always felt I was coming short. So this brought a lot of mental issues. But with time, I realized I needed to compose myself, appreciate what I'm doing, because already the 100,000 I'm targeting are already doing what. So the comparison was a big issue. For the students that I deal with, the need to get more likes, to get more views on TikTok, on Facebook, is an ever-emerging issue with them. And you realize they struggle with it so much, because sometimes you put good work and then you don't get the likes or the views that you want. This usually brings, again, a lot of mental issues, because you'd expect the information or content you're putting out there to be consumed. So comparison is also a major issue on that. The other one is on performance pressure. I realize when I'm doing live graduation, I'll have even the VC herself calling to check why are you not on air, what's going on. I'll have various directors on my case. When do you want to have this production or this particular way? When are we having my director? And also while at it, when doing those live production as it is, it's really tasking because I'm working with students. And keeping their attention span on such kind of production might sometimes touch on a nerve because they don't see the seriousness in it, or they'll be on their phone and we're doing something serious. So I've really learned on how also to balance all these pressures while I'm working. Another emerging issue right now is job loss. With AI coming on board, with the digital transformation that is happening, I realize a lot of people are being let go because more and more work is becoming efficient through such kind of digital technology that are emerging. And I'm always asking when I will be considered redundant when an AI tool, for example, comes to help with live production and directing. Another emerging issue with the digital media right now is the emergence of a lot of social vices. You realize TikTok right now at night has become a totally different thing. It's not what you see during the day. So a lot of sexual, drugs, and other vices are cropping up. And the students at the university I work with are at the major part of this. Because with social media doing something called getting information that reaching out to you involuntarily, is also happening a lot with the social media platform, and then they have to consume it. I heard someone says there are pop-ups which will come up, and this is affecting even younger guys. A pop-up will come up and you will click on it and it takes you to a totally different site. So impacts of such are usually detrimental to somebody's psychology and how they carry out themselves. On how a role we play as a campus media, I've really tried to ensure that the content we are having is safe and palatable to our audience. Because I have 24 shows, and I have to ensure all of them, the production quality is okay, the content being transmitted is okay. The experts brought on board are going to help in complementing to ensure that that content is of value to the person who is going to be coming on board. Another one is